This is a great question, and I've had 2 consults for this week, and it's actually a really difficult problem. So having skin looseness right above the belly button, but not really everywhere else on your abdomen is really common. There's a lot of women out there that after pregnancy and stretching of their belly, when everything's snapped back, they end up with a little bit of wrinkly skin right over the belly button. And that area often, because of pregnancy, it stretches and thins the fat in that area too, and there's a little depression. So this can be a really difficult fix. So the first thing you always want to consider when you have loose skin above the belly button, do you have enough loose skin over the abdomen to do a formal tummy tuck? Because really the best treatment that will get everything smooth is to do a tummy tuck where you lift everything up and lift everything down. Now, often with people, they don't have enough extra skin, and so that really limits what we can do in the area. The little bit of isolated loose skin, the best option usually is some kind of skin tightening device. So radiofrequency microneedling, you can do a high frequency focused ultrasound treatment. There's all types of different options. You usually have to do multiple of them, and then you do have to repeat them on a schedule to keep that skin tighter. Now, like I said before, there's sometimes thinning of the fatty tissue in that area. So you can actually add some fat back and plump the area up, and the skin won't look as loose. So sometimes a little targeted fat grafting or using a fat substitute like Renuva can help that area look more smooth without doing anything to the skin. And it's important to consider that if you're doing those skin tightening treatments, sometimes it can actually thin the fat there even more. And so doing both of those things together could be the right choice. Now, the final option I always mention to people is that you can actually just directly excise the skin. So depending on how loose you are, sometimes excising the skin this way in a reverse abdominoplasty, where you end up with an incision right underneath the breast and pull everything up, can be helpful. That's a really problematic incision. It's often visible in clothing, and it can distort the breast crease. So it's not a great option for a minor fix. I think it's kind of a long run for a short slide. Now, I've seen many patients where surgeons will cut out an ellipse of skin and just make a big incision in that area. And it's certainly an option. It's not my favorite because, again, it's a visible scar. And it never quite looks right. It looks strange in my opinion, but it's not wrong. You're trading that loose skin and depression for a scar over the belly button, and it just looks like kind of a big umbilical hernia scar. So that's all of the things that I typically talk about with my patients who come in with this problem, and it really just depends on how much laxity you have, how big the area is, and whether or not you need a little extra fat or something under the skin there, and that's how you decide what's the best option for you.